Hi, everyone. Welcome to the LactFact podcast, which highlights recent clinically relevant research, policy statements, and protocols that you, as a practicing lactation professional, would probably like to know about. I'm your host, Dr. Eglash. I'm a board-certified family physician and breastfeeding and lactation medicine specialist at the University of Wisconsin School of Medicine and Public Health. This podcast is written and produced by the nonprofit organization IABLE, which is the Institute for the Advancement of Breastfeeding and Lactation Education. We have no commercial funders for this podcast series. Hi, everyone. In a few days, it'll be 2026, and I wish you all happy and healthy New Year, and thanks for listening to the IABLE podcasts. Today, I'm discussing a study regarding HTLV1 virus, also known as the human T lymphotrophic virus type 1, and I'm going to stick with the term HTLV1. Let's review some background first. Pregnant women in the United States and in other countries are routinely screened for certain infectious diseases, such as rubella, syphilis, HIV, hepatitis B and C, and group B strep, but not HTLV 1 and 2. HTLV 1 and 2 are viruses identified 40 years ago for which we have no treatment or vaccine to prevent infection. People infected with HTLV1 have a 2 to 6% risk of adult T-cell leukemia or lymphoma, and a 2 to 3% risk of tropical spastic paraparesis. HTLV2 is a much less virulent cousin of HTLV1, although people infected with it can have a higher risk of cancer. HTLV1 is transmitted horizontally through sexual intercourse and infected blood. It can also be transmitted vertically. Breastfeeding is the primary means of maternal to child transmission, with an estimated 20% of breastfed newborns contracting HTLV from their infected birth parent. This is because the virus prefers to live in immune cells, which are, of course, abundant in breast milk, and infection involves the transmission of cells that contain the virus. The virus does not live extracellularly, which is probably why there's less transmission transplacentally or during the birthing process as compared to breastfeeding. And the risk during breastfeeding is higher with higher maternal viral loads and a longer duration of breastfeeding. It's estimated that 5 to 20 million people worldwide have HTLV1 infection, with less than 1% of people in North America being infected. About 1/3 of the population with HTLV1 live in parts of Japan, Africa, South America, Australia, Iran, and in the Caribbean. Because the United States is a melting pot with people who originate from every country, there continues to be a low-level risk of HTLV1 infection. The American Red Cross, which tests for HTLV1 and 2, estimates that 2 in 100,000 donations are positive. Screening for HTLV1 has been implemented in many countries where there's a high prevalence, such as in Japan. A national antenatal screening program in Japan reduced maternal child transmission from 20% to 2.5%. Even in the UK, where prevalence is much lower, screening during pregnancy has been found to be cost-effective. In the United States, pregnant women are not routinely screened for HTLV1, as I mentioned before. The article I want to discuss today is a survey done among OB providers in France to measure their knowledge regarding the contraindications of breastfeeding with HTLV1 infection and its endemic geographic regions. HTLV1 prevalence is higher per capita in France compared to the United States because of being closer to Africa and migration from former French colonies where HTLV1 rates are endemic. This survey was conducted in 2022 and sent to thousands of OP providers in France. They received 936 completed surveys. 75% were from midwives, 22% were from OBGYNs, and 3% were from general practitioners. They found that only 27.5% of the respondents thought HTLV1 infection was a contraindication to breastfeeding. Those who were more likely to be knowledgeable worked with a high percent of migrants or an endemic French overseas territory such as West Indies or Guyana. That said, Only 32% of participants working in those regions were aware of HTLV1 infection being a contraindication to breastfeeding. When asked about screening pregnant women for HTLV1 infection, 6.6% said that they often test for it, 14.5% said that they sometimes test, and 79% said that they never test. Those with specific training in OB infectious disease were much more likely to test for HTLV1 in addition to those who practiced with a significant percent of immigrants or worked in endemic overseas territories. At least 75% of the respondents did not know which countries were endemic with HTLV1 infection. After the survey was published, French Infectious Disease Society drafted screening guidelines to include screening for HTLV1 for all women of childbearing age from South America, the Caribbean, and Sub-Saharan Africa. I think this is a lesson for the USA. I suspect without any evidence that we need to increase awareness of the risk factors for HTLV1 infection and screen high-risk populations, especially during pregnancy, to prevent spread of HTLV1 during lactation. There is evidence that limiting breastfeeding to 3 months does not increase the risk of HTLV1 transmission because of the existence of HTLV1 antibodies transmitted transplacentally, which hang around in the newborn for a couple months. In addition, research in Japan has preliminarily shown that freezing and thawing breast milk to 20 degrees Celsius for 24 hours markedly decreases the risk of HTLV1 transmission because of the freezing process seeming to kill the virus. There is insufficient evidence that flash pasteurization or Holder pasteurization of infected milk eliminates the virus. Hey everyone, thanks for listening. I encourage you to check out iAble at lacted.org, which is LACTED.org, to learn more about our educational projects, courses, educational handouts, videos, live conferences, and webinars. By becoming a member, you are not only supporting our free projects, but you will also receive a series of benefits which you can learn about at our website. I'll be back with another LactFact in a few weeks.